Hi all, I am Dr. Karthikeyan. Generally we used to visit doctor for cough, cold or fever. But these days we are visiting the doctor clinic for one another symptom which is overtaking all other symptoms, which is back pain. Nowadays back pain is affecting all age groups. It need not be the old people. Now it is affecting even the college going younger generation, middle aged people and also older people. However, the interesting thing is in 99% of the cases with simple remedies such as very simple stretching exercises, we will be able to reduce this back pain permanently to a great extent. In addition, there are so many doubts with respect to back pain, in which position we have to sleep, whether we have to sleep on the mattress or sleep on the cot or sleep on the floor when we have back pain. Suppose we have to sit for very long hours because of our work. How should we sit and in what position we have to sit? And before doing back pain exercise, there are certain things we have to do. So what are those things? Is there a necessity for tablets? And when should we really see the doctor? So these are the questions which we will be answering in this video. Welcome to our channel. So before we get into the remedies for back pain, we have to first understand what is this vertebra. One of the most wonderful creation by God is vertebra. There are about 33 vertebrae here. You all know that it is a S-shaped, elongated S-shaped vertebra. There are three curves here. There is a cervical curve here. There is a thoracic curve here. And there is a lumbar curve here. So what is the reason for this curvature and what is in between the vertebra? In between the 33 vertebra, we have the disc. So what is this disc? This disc is a rubbery structure which gives flexibility to the vertebral bones, and this is the shape of the disc. The outer annular ring is hard cartilage and the center one is a gel-like thing. So this disc and this curvature is very essential for the flexibility of our body. We are able to climb up, we are able to rotate our body, we are able to bend down. All these movements are possible because of the shape of this spine. But the most important reason for creation of the vertebral column is not our movement, but to protect our spinal cord. So we all know the decision maker is brain. From brain the signals come through this vertebral column. It enters the spinal cord and then through the spinal cord the information reaches all parts of the body. So if there is any problem even in this small point in this cervical region, if there is a damage, then we will suffer from quadriplegia. No organ will work. Our hands will not work, our legs will not work. We will be just lying on the bed like a vegetable. So that is the importance of this spinal canal. So the spinal cord is safely protected by this vertebral column as well as the muscles surrounding this vertebral column. So this spinal cord is always in motion, in movement. So because of this movement, we may get pain. When you get neck pain, the problem might be there in the cervical area. We have 7 cervical vertebrae, C1 to C7, and then there is another set of thoracic vertebra, T1 to T12. There are 12 thoracic vertebra, but the thoracic vertebra is ably supported by the rib cage, the rib bones attached to this thoracic vertebra. But see, come to the lumbar region. The lumbar region is the most difficult area. See, the bones are very big and it is not supported. It is only supported by the surrounding muscles around this lumbar area. So the lumbar area is a place where it supports our entire body. Whichever movement we do, our rotation movement or climbing movement, lifting weight, the lumbar area gives all the support, it takes all the shock. The most important reason for low back pain arises from the lumbar region pathology. So let's see what it is now. How this back pain happens in the lower part of our body. See, this is the vertebral column. Now you are seeing it's in the straight view. This is the side view which we saw. In straight view, this is the view, and we can see this is the lumbar area, this is the sacrum area. So between L4, L5 and between L5, S1, there are two main nerves which are coming out of this intervertebral area. In between the intervertebral disc, many nerves come outside. So this is the main spinal cord. From spinal cord, the nervous system is branching out and it is coming out through the intervertebral area. Now through the intervertebral area, when it comes out, the nerves are passing very close to the disc. So what will happen is when there is a problem or damage in the disc, so the damage in the disc leads to the leakage of the jelly outside. This jelly will compress the nerve which is coming outside here, which will lead to irritation, and if it is severe, it leads to sciatica. The pain just transmits to the legs and even to the knees, or even until the foot. The pain will transmit, the tingling and numbness will transmit all throughout the leg because of the compression of the nerves here. But the most important reason for our low back pain is not damage to the disc. So we have to remember that most important thing is this, because the disc will not get damaged easily. It is a very strong structure. It will get damaged only when there is a severe force, a severe injury, when you are falling from the top, or when there is an accident, when there is a severe pull on the body. So during those times that the disc will get damaged. Most often the lumbar back pain is not because of the disc prolapse, but it is because of the muscles surrounding the vertebral column, surrounding the lumbar area, supporting the lumbar area. So what are those muscles? And the strain, the muscle strain, muscle spasm and muscle tightness happening around the vertebral column in the core muscles and in the quadriceps and the hamstring area is responsible for our back pain. We all know the quadriceps area is responsible for lifting our leg towards our hip, towards our stomach, and also the hamstring muscles are responsible for bending our knees, and it's also responsible for lifting our leg. So they become very tight when there is back pain. Sometimes the core muscles in this area will get tight, or sometimes a very small muscle called piriformis is located here. The piriform is a very small muscle, but it can get tight and it can cause severe low back pain. So in this video what I am going to tell you are simple 9 stretches. So if you do these stretches, all these muscles will get relaxed. Once the muscles get relaxed, the back pain will reduce. That is the concept behind this video. That is the concept behind low back pain. Even sciatica can come not only because of disc damage, but even sciatica can come because of muscle tightness which is compressing on the nerve, which can lead to sciatica. That also can happen. So when the muscle tightness and spasm gets released, the sciatica can also reduce. See, in spite of doing the exercises which I am going to tell you in this video, still your back pain is continuing. There could be many other reasons for back pain. For example, urinary tract infection or appendicitis. This also can cause back pain. Sometimes when the back pain is associated with fever, it says there is some infection in the body. Because of that back pain is coming. If the back pain is associated with loss of control of bladder, loss of control of bowel, you are passing urine without your control, you are passing motion without your control, or if the back pain is interfering with your daily activities, you are not even able to sleep because of back pain, you are continuously feeling nausea and vomiting, then these are the situations when you should not continue with the exercise. You have to immediately go and see the doctor for help. We should not start exercise directly in these situations. The most important reason we get back pain is because of lifting the weight in an improper way. Suddenly we twist, suddenly we lift the weight, and this is the most important reason. When we are lifting heavy weight, we have to take care that we don't directly bend our hip. If we directly bend our hip, what happens? The weight of the object is mainly attacking our lumbar area. Instead of we directly bending, first we bend our knees. I don't know whether you're able to see in your video. First we bend our knees and then you lift the object. So when you're lifting the object, what happens? The quadriceps, hamstrings in the thighs, they take the weight of the object. Our lumbar area takes the weight of the object. Our hands take the weight of the object. So the weight is evenly distributed in all parts of the body. So always be very careful when we are lifting the weight. Another important reason is sitting for very long hours. We may suppose we are going for a long journey, we are sitting in the train for a very long journey, or because of office work, every day we have to sit for very long hours. What will happen is it adds stress to our lumbar area. In due course of time, the muscles get spasm, they get tight, and then the pain starts. There are 4 rules. So always we have to follow these 4 rules. The proper method of sitting to prevent back pain. So what is the first rule? Always choose a chair which has lumbar back support. Never sit in a chair which doesn't have a lumbar back support. It will aggravate your pain. Second thing is, when we are sitting, our sole of the feet should completely touch the floor. Both the front part of the sole, the back part of the sole. Imagine this is the floor and this is my foot should completely rest on the floor. Like this, both the foot should rest completely on the floor while we are sitting. That is the second important rule. Third important rule, we have to sit straight like that. When we are sitting like that with back support, with soles completely resting on the floor, we have to sit straight. That is the third important rule. Fourth important rule, never maintain even this posture for very long time. Every 20 to 30 minutes, always get up from your chair, have a small walk, just twist your hip and then stretch your shoulders and then stretch your neck. So like this, you give some stretches to your body and then you go back to work. So these 4 cardinal rules always follow when we are sitting for very long hours. When you have a low back pain, it will never recur again if you follow this sitting posture. Second thing is in what position we have to sleep. Now, some of our relatives or friends will advise you to sleep on the floor without any mattress. It is definitely a bad advice. It will not give relief because the floor's curvature, floor is straight and the spine is curved. So we have to give adequate support for the back wherever there is a curvature. So that is not possible on the floor. So it is always better to choose a good foam mattress. We have to sleep on the mattress, but in what position we have to sleep on the mattress is another question. The best position for alignment of the spine is supine posture. Just in supine posture, when we are arms lying on the bed and sleeping, it is the best posture for spine, but not for all other organs. The best posture for sleep is slide, where you are turning to the side and sleeping. What will happen? The health benefits of sleeping on the side is your heart is easily able to pump the blood, your snoring gets reduced, obstructive sleep apnea, another sleep related snoring problem, gets reduced when you sleep on the slide. Another thing is acid reflux. If you are having an acid reflux problem, GERD, gastroesophageal reflux disease, sleeping turning towards your slide will reduce all these problems. So because of these health benefits, sleeping on your side is always the best. For back, it is not giving a complete alignment for your back when you are sleeping on the side. So there is a trick here. Here what you have to do is, in between your knees, you have to keep a pillow. Like I am showing in the video, always keep a pillow between your knees when you are sleeping on your slide. So this will align your spine, this will reduce your back pain. But there are people who will tell, I cannot sleep in supine position, I want to always sleep in prone position. From my childhood, I am used to sleeping in prone position, I cannot change. If you say that, don't worry, you need not change. You can sleep in prone position, but at the same time, you have to give support to your knees by keeping a pillow below your knees. So if you keep a pillow below your knees, your spine again gets aligned even in prone position. See, the last part of the video now is we are going to do the stretches. I am going to demonstrate to you how to do the stretches. But before doing the stretches, it is absolutely necessary to warm up your body. It's very, very important. Warming up is not a very big deal. Just walking or running for 10 minutes, 5 to 10 minutes is more than enough. It will pump the blood to your muscles. It will give warmth to the muscles, ready for the stretches. But for old people, if you are not able to go for walk or jog, nothing to worry. Just take hot water bath. Just by taking hot water bath, what will happen is the hot water will cause vasodilatation. The blood will move freely inside the muscles. It will warm up your body. So just taking a hot water bath before doing a stretching is more than enough. Another third important point is it is not necessary that you should always do the exercise in the morning hours for low back pain. This stretching can be done at the time of the day when you have the least pain in your body, or when you don't have the pain, low back pain. That is the time you have to do these stretching exercises. So with this background in mind, let's quickly jump into the stretching exercises now. So now I am going to demonstrate the exercise. Before that, I was telling about sleeping position, right? So the position in which we have to sleep is very, very important. So we have to sleep on our side with a pillow in between our knees. So this will properly align our spine and it will greatly reduce our low back pain. And when we are sleeping, always alternate positions. Don't continuously sleep in side position in the left side. Now we can alternate to right side. So in this way we have to sleep. So now I am going to demonstrate the first exercise. The first exercise is very simple. First we have to relax our shoulders and then we have to lift our legs. Slowly we have to lift our legs and bring it towards our abdomen and then hold our thighs like this with both hands. You hold both the thighs and then you maintain this position for 10 to 30 seconds. So this is a knee stretch and it gives great relief for low back pain. So while doing this, always take deep breathe in, deep breathe out. So in this way you maintain for almost 20 seconds and then extend your legs back. So this is one rep. Like this you have to do
2 to 4 reps. So this is the first exercise. So next exercise is press-still exercise. So in this knee press-still exercise, what we do is we bend our right knee. Our right foot is on the floor, right knee is bent, and then you slowly bend the left knee and keep it over the right knee, right? So now the left foot is facing the wall. Now hold your thighs. After holding your thigh, slowly lift your foot and bring the right knee towards your abdomen. So you stop when you feel the stretch in the left side. So you will feel a definite stretch here in this area. Actually what we are doing here is we are stretching the piriformis. Remember in the video I told about piriformis syndrome. So what we are doing here is a piriformis stretch. So you hold this position for 10 to 30 seconds. You also do deep breathing and now bring this back. And now repeat the same for the left knee. Left knee is straight on the floor and bent. The right knee is facing towards the wall. And now you are grabbing the left knee, left thigh, and then you are bringing it back towards your abdomen. And then definitely you will feel a stretch here in the right side. So you stop at that point and then you count 10 to 30. So like this you can do 2 reps. So the next exercise is double knee torso rotation. Just bend your knees, keep your shoulders stretched out like this and relaxed. Now you have to lift both your knees, and now what we are doing is with your knees, both knees bent, you are slowly moving it towards your right side. At the same time your head is rotated towards your left side. So maintain this position for 10 to 30 seconds. And try to bring this knee part as close to your abdomen as possible. And now you are bringing it back after 30 seconds. And now you are doing on the opposite side. You are moving your knees towards your left, but you are moving your head towards the opposite side. So maintain this position all throughout the exercise. This knees should be together. Your hands on both sides should be stretched out, relaxed, and always touching the floor. So do this rep. This is 1 rep. Like this you have to do for 2 to 4 reps. So the next one is butterfly stretch. Just like the wings of the butterfly, the knees bent as usual, and then you bring your heads back towards the back of your neck, and with your elbows pointing towards the ceiling. Now what we are going to do is we are going to stretch this elbow like butterfly spreading out its wings, and you are going to touch the floor with your both elbows touching the floor. You will feel a stretch here, this side, and your chest, the back of the chest should be pressed firmly against the floor. So in this way you will feel a stretch. You count 10 to 30 seconds and deep breathly, and then you bring it back to the normal position. This is 1 rep. Like this you have to do for 4 reps. So the next exercise is Cobra Stitch. Same like a king cobra, we are going to do this stretch. So in this exercise, first we are keeping our forehead on the floor, and our shoulders are relaxed. And now what we are going to do is we are going to keep our hands just below the shoulders, both hands on both sides, just below the shoulder level, and then we have to slowly lift our shoulders and chest and head. We are not going to lift our abdomen. We are just going to lift the shoulders, chest and our head in neutral position. Maintain this position for 10 to 30 seconds. So this is called Cobra Stitch. So and then go back to the normal position. Like this we have to do for 4 times. So the next exercise is knee hip flexor. So this is the starting position. Here our knees are bent, my hands are bent, and now what I am going to do, I am going to stand straight on my knees. I am going to put my left foot in front of me, and then I am going to push my hip forward with the help of right hip. So like this I am going to maintain for 10 to 30 seconds, and then I am going to alternate this for the next side. I am going to keep the right hip forward and I am going to press my left hip forward. So this is 1 rep. Like this we have to do for 2 times. If you are feeling difficulty, if it is not soft, your knees may pain, you can even keep a pillow and then you can do this. So the next is hamstring stretch. Hamstring is the muscle behind our thighs. This is a very strong muscle, but when it becomes tight, it gives severe back pain. So this stretch will help, hamstring stretch will help in reducing your back pain. So we need a strap for this. So keep this strap below your right foot and then slowly lift it towards the ceiling and try to straighten it as far as possible. When you are trying to straighten it, you will definitely feel a stretch here in this area. So this is the hamstring stretch, so which we are doing now. 10 to 30 seconds you maintain this stretch and then you bring it back to the normal position, and then you can repeat this for the next leg. So when we are placing the strap, see that we are placing it in the middle of the sole, so that there is a grip is there, and same like before, we are straightening it as far as possible, and we will feel a hamstring stretch. So count 10 to 30 seconds. So this is 1 rep. So like this we have to do for 4 reps hamstring stretch. Next what we are going to do is full body stretch. So don't get frightened. Full body stretch is nothing but we are keeping these straps shoulder width apart here on both sides. Now we are firmly holding the strap. So now the first step is, see my legs here, both the legs. I am going to stretch the foot towards the floor. So in this way I am stretching my foot. At the same time we are lifting the strap shoulder width apart slowly towards the ceiling, and then slowly towards the back as far as possible. We are stretching it back. At the same time, see my foot, that is also stretched as far as possible towards the floor. So this is called full body stretch. Maintain this stretch position for 10 to 30 seconds and then you bring it back to normal. So this is 1 rep. So like this you have to do for 4 reps. So the last exercise is side stretch with strap. What we are doing here is we are sitting comfortably in this position, and now we are holding the strap in both hands in the shape of V. So we are holding it tightly now, and now what we are going to do is slowly lift the strap without bending your elbows towards the ceiling. After lifting it, slowly bend towards your right without bending your elbow. So when you are doing this, you will definitely feel a stretch in your right side shoulder. Maintain this position for 10 to 30 seconds and then you bring it back, and then you do it on the opposite side without bending your elbow. Stretch and touch the floor. You can feel a stretch in your right shoulder. Maintain this position for 30 seconds and then bring it back and then bring it down. So this is 1 rep. So like this we have to do for 4 reps. So this is the last exercise. So I hope whatever tips I gave you till now in this video is going to be very useful for you in reducing your lower back pain. 99% your pain will reduce if you do all these things whatever I told you in this video. But if you are still not getting relief, please put a comment in the comment box below. Let us explore what is the reason for the pain not reducing. Let us explore together. See, your friends or relatives right now may be suffering from low back pain. So kindly share this video with them so that it will be very useful for them for reducing their back pain. If you like this video, press that like button. Kindly subscribe my channel. I will meet you all once again in another useful video. Until then, goodbye from Dr. Karthikeyan. Thank you.